Okay, so we are doing the inhaled medication. This is time for 12 minutes in actual OSCE, but we are doing this in 11 minutes. Right. Okay, introduce yourself to the camera before we start.
Hello, my name is Nurse Shari, and I will be performing administration of inhaled medication, new OSCE.
Right, timer starts now.
I do hand hygiene according to WHO guidelines. And I'll don my gloves and my apron before entering the patient's room. So assuming all the initial checks has been done, safety, privacy and dignity, allergy, check identification, I'll go now to my patient. Hello, my name is Nurse Shari, and today I will be giving you your due inhaled medication. Is that alright with you?
Yes.
Okay, but before that, are you comfortable in your position?
Yes.
Okay, are you in pain?
No, I'm okay. Thank you.
Okay, so let me provide a call bell to you. I will just prepare the equipment.
Okay.
Okay, so I'll go through my prescription check. Patient's name CORRdapya, Reading, Berkshire, RGG3BB, date of birth November 5th, 1986. No known allergies. Drug name is salbutamol evohaler, 100 micrograms. And the dose is 2 puffs to be inhaled 4 times daily. And it's actually due today, which is 1800. It was actually prescribed and signed by Dr. John Adams. I can confirm that the prescription is valid, legible, signed, and complete. So I'll go now and prepare my equipments. I do have here my tray, which is cleaned within the 24 hours, so I'm happy to use this one. I have here my spacer, which is dry, intact. I'll make sure that it's actually properly labeled for the patient, and there's no lint. Okay, so there's no actually obstruction. I'm happy to use. I do have here the medication, which is the salbutamol, which is actually in service date, dry, intact, with a batch number of 114893B. I'm happy to use this one. So let me go to my patient. Hello, I am here now, and I do have here the prepared medication. Let's do the secondary identity check. Can you please confirm your name and your date of birth?
Name is CORRdapya, date of birth 5th of November 1986.
Okay, so I'll verify that on your ID band, CORRdapya, November 5th, 1986. And do you have any known allergies to food, medication, or latex?
No.
Okay, I verified that on your record. So right now, this is actually the spacer and the metered dose inhaler. So I should position you first in a upright position. I'll make sure that your legs are not crossed, and you should slightly tilt your head backwards for the full absorption of the medication to your lungs. Is that all right?
Yes.
Okay, so usually we do have here 2 techniques, Core. The first one is the single breath technique, and the second one is the tidal wave breathing or the multiple breaths technique. So let me educate you about the first technique, which is the single breath. So before we give you the medication, we need to shake this for 2 to 5 seconds. Okay, we need to put that here in the spacer, and you need to hold it horizontally. You need to exhale first, and you need to grasp the mouthpiece with your teeth and tight seal it with your lips. And as I press the canister, you need to breathe 2 to 3 seconds and hold your breath for 10 seconds. And remove the spacer and exhale using your pursed lips. So do you understand that, Core?
Yes.
And the second technique is if you're unable to hold your breath for more than 5 seconds. So hold it with your hand horizontally. Exhale first. Grasp it with your teeth, tight seal with your lips. As I press the medication, you need to breathe in and breathe out for 5 times simultaneously. and remove the spacer and exhale using your pursed lips. Okay, do you understand that, Cor?
Yes.
So what technique do you prefer?
I prefer the first one, the single breath technique.
Okay, so let's do the first puff, okay? So I'll shake the medication first for 2 to 5 seconds. Put it in the spacer. Hold it horizontally. Exhale first. Grasp it with your teeth and tight seal it with your lips. And as I press it, 2 to 3 seconds, inhale. Hold your breath for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Remove and exhale using your pursed lips. Alright, so how do you feel right now, Cor?
I'm alright, thank you.
Okay, so since I will be giving you the same medication, which is salbutamol, I'll just need to wait for 30 to 60 seconds before administering the second puff. Okay?
Okay.
However, if it's going to be a different medication, like for example, it's a steroid and a bronchodilator, okay, I need to wait like for 2 to 3 minutes before administering the second puff. So are you ready now for the second puff?
Yes.
Okay, let's shake it first, 2 to 5 seconds. Put it in the spacer. Hold it horizontally. Grasp it with your lips. Exhale first. Grasp it with your teeth. Tight it seal with your lips. And as I press the canister for 2-3 seconds, inhale. Hold your breath for 10 seconds. 10, 9, 8, 7, 6, 1. I remove it. And exhale using your pursed lips. Okay, so how do you feel right now?
I'm okay. I'm relieved.
Yes, that's awesome. So right now, I've already given your due medication, which is due today for 1800. How do you feel right now? Do you want me to reposition you in a comfortable position?
No, I'm okay. I'm comfortable.
Okay, so do you feel any pain?
No.
Okay, so usually this spacer, it's actually for your personal use. So we just need to clean this with alcohol wipes or with the soap and water. Make sure it's actually dry. And you just need to put it in your cupboard for your personal safety. Okay?
Yes.
So I will just go now. I will be monitoring you for 30 minutes in case you're going to develop any adverse reaction or any signs after giving you the medication. Okay? I will provide you a call bell. Don't hesitate to give us a call, okay?
Okay.
Alright, so I'll go now and thank you for your cooperation, Cor.
Alright.
I'll dispose my equipment to the clinical waste bin. And I'll do hand hygiene according to WHO guidelines. And I'll document the procedure and the medication to the patient's chart. Today, time 1800.
What will you document? Just verbalize it because you already.
So what I will document here is of course my signature, which is due today, and the time, which is 1800. Nurse's notes, salbutamol evohaler 100 micrograms given 2 puffs at 1800. Okay, and also my candidate name and my number.
Anything that would you like to add? Health teachings, perhaps?
So the health teachings, it's actually between the same medication or a different medication. So since I have mentioned earlier, if it's going to be a different medication, it should be like a difference of 2 to 3 minutes. Okay, so we need to rinse the mouth carefully to prevent fungal infection if you're going to administer the inhaled medication, which is the steroids. And also, if it's going to be the same medication, it should be a difference of 30 to 60 seconds.
You happy to finish?
Yes.
Yeah. So you still have actually 1 minute and 26 seconds, but in the actual OSCE, you have spared 2 minutes and 26 seconds. So definitely the examiner will ask you a lot of questions. So you can add health teachings like asthma related health teachings, like prior to doing the inhaled medication, the patient should have rested for at least 20 minutes because it will affect on the ability to hold the breath Yeah. So you can add that one, like, have you rested for the last 20 minutes? Because if the patient has been active before you administer the medication, then definitely it will affect the capacity of the lungs to hold the medication. And you can also add, when checking your equipment, you can add with your air chamber. So I can confirm that this air chamber is clean, no lint, no precipitate, no obstruction, and it's labeled with my patient's name. And if it's in the clinical setting, ideally there should be the date of use that was opened, and ideally the air chamber will last for a year of use.
Yeah, it's within 12 months.
1 year.
1 year.
But if it looks like really dirty, then you can change it maybe for a few months. And then if you are giving the inhaled medication in a clinical setting, you have to store the medication back to the trolley. It's important.
Yeah, I need to verbalize.
Yes.
For this medication, I need to put it back to the trolley.
Yes, if I am in a clinical setting, I have to store this medication back to the trolley. And if it's in a community setting, then you can just verbalize that I need to store this medication.
Yeah, because I said I dispose everything, put it in the personal cupboard. But how about this one?
Yes, you will not dispose that one.
Yeah.
So if it's in a community setting, you can just mention that I will store it in the patient's cupboard, like that. And you can also add in your health teaching about encouraging oral hygiene. You can add that one. What else? You can also make chica, like have you been smoking? Like that. You can just consume your time doing health teachings, like, have you been smoking? Some of us asthmatics are smokers, so you can add in your health teaching about smoking cessation, encourage exercises, like, have you been doing some exercises? It will help with your asthma condition, because it will improve your lung expansion, blah 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 blah. Because you have a lot of time. That's good, actually. Good. But don't forget your documentation. It's very important. All the parts that you see that is empty, you need to fill it in. Which comes first?
It should be the bronchodilator first before giving the steroid inhaler.
So you have done the checks correctly. Prescription reading. Prescription reading is good. You have confirmed that the prescription is valid and legible. Then when preparing your medication, if it's a new medication, you have to actually remove
this one.
remove this one, and then check for the expiry date and batch number.
Okay.
And if it's a new medication, you have to spray it twice or once, I think, in the air to make sure that it's working. That's why I'm reacting with your documentation, because
It's actually confusing, no, this one.
you still have to put your signature here,
Okay.
date and time.
I didn't notice this one. I thought this is the one.
No, apart from this one, you
There's
need to
another
sign on the
one.
side, there's signature of nurse, and then date and time. That's very important.
Yes. That's documentation.
Even this one is fine, no problem with that. Make sure if you miss something. Yeah.